If Medicare feels like alphabet soup to you, you're not alone. You have Part A, B, C, and D, and then something called Medicare Supplement. And what do they all mean? I'm going to break down each part of Medicare in plain English to you, show you the two main pathways you can choose from, and bust the biggest myths that trip people up. By the end of this video, you'll understand your main coverage options and how much they're going to cost you in 2025. Let's dive in. First, let's get the big picture. Medicare is federal health insurance for anyone ages 65 and older, and sometimes for people under age 65 with certain disabilities. And here's what most people don't know. You have three main ways to get complete Medicare coverage. Option one would be original Medicare, Parts A and B alone, but that leaves you with big gaps in coverage. Option two would be original Medicare with a Medicare supplement and a prescription drug plan on top of that. This is going to be the most complete coverage. And option three, Medicare Advantage, also known as Part C, which bundles all these together. Think of it like option one being your basic cable package. Option two, you have your cable package, premium channels, and subscriptions. And option three is like switching over to a completely different TV provider that makes it all in one package. Let's start with Part A. This is going to be your hospital insurance, and this is going to be the base of everything. If you worked a normal career, Part A is probably free for you. And here's what Part A covers: hospital stays, skilled nursing facility care, after a hospital stay, some home health care, and hospice care. A real world example would be you have chest pain, you go to the emergency room, and they admit you for 3 days for heart monitoring. Part A covers that hospital stay, but you'll pay $1,676 deductible in 2025. Now, Part B is going to be your medical insurance. This covers doctor visits, outpatient care, medical equipment, and preventative services. Everyone pays for Part B. The standard 2025 Part B premium is $185 per month, plus there's a $257 annual deductible. After that, you're typically paying 20% of the Medicare approved amount. Another real-world example of this will be you go to your primary care doctor for your annual physical, then you need to see a cardiologist, and they order an EKG, blood work, all that is Part B, and you'll pay 20% after your deductible. Now, this is where the gaps start showing up.